All right. So she cut back on her Synthroid. I put it down to the Cellerciser since it's the only change that I've made in recent months. Thank you all so much, and a special thank you to Jerry for taking the time to talk to me on so many occasions. You are always so helpful. I will continue to refer people to your direction. Christopher writes, been on this for the last 2 years. It was either this or the latest gaming system. Stop gaming and focus on uncovering the better version of myself. Thank you for all the information provided. I love how I feel in my 5th season and 2 episodes in this life's journey. Melissa writes, hi Davis, Melissa, I've talked to you a couple years ago before buying my Cellerciser, and you were so encouraging. I was struggling with some issues in my right knee, but it never did go get an MRI. I was suspicious of a torn meniscus. Anyway, with patience and the help of the Cellerciser, my knee eventually healed. Well, about 5 weeks ago, my hubby and I went to Chicago and came back with an injury to my left knee. It seemed to be a combination of a lot of walking, hitting some uneven pavement. I remember my husband saying, honey, you need to pick up your feet better, and going downstairs from the 11th floor where we were staying. I remember thinking stairs shouldn't be a problem since I was feeling quite strong. We both felt sore, but nothing too surprising. We were there about 3 days before having an all-day conference the next day. That's when the pain set in. I resisted going to the doc since I was able to get through it successfully with my right knee. After only 5 weeks with this left knee, I started to question if this injury was worse or maybe it would be best to have a diagnosis. The good news is my x-ray showed no signs of arthritis. I'm 56, but I'm waiting on the MRI results. My doc seemed to be very oriented towards surgery, and I fear that's what he will recommend. If I remember right, Dave, you had some serious knee issues and never had surgery. I would love for you to remind me of your story. I will actually get my results on Monday when we go live, so should have probably waited to include those, but was just excited to reach out. We'll keep you posted and sending much love and gratitude for all you do. And yes, I will talk about my personal experience on the Cellerciser again. Bun writes, I'm a firm believer. Used to have reoccurring sciatic nerve issues, but it's all gone after I bounce on it daily and my arm and back are leaner. So convenient when I can just do it at home, whether rain or shine. My best investment of all workout stuff because the rest never lasts. Thank you. Thank you, Bun. That was good. Shalom writes, I have asthma and I've needed to use an inhaler many times per day for the last 8 years. Since starting to do the power breathing 4 to 5 times a week for the last 3 weeks, my need for an inhaler is way down. I'm looking forward to that improving even more as I continue. Guys, keep sharing the message. Thank you for sharing that, Shalom. And yes, I talk to people all the time on how that helps with the breathing. We still get on sound? Good. Pat says, I get on my Cellerciser daily. When I didn't use it for a month of December when I was sick, my doctor could tell the difference in my lymph system. I wasn't working optimally until I got well and could get on my Cellerciser again. Thank you, Pat. Marie writes, I've had great improvements with digestion since doing this gentle twisting motion. It seems to have made my body more regular when going to the bathroom, and I am a lot more comfortable. So simple and yet very effective, plus drug-free. Thank you for this lesson, Dave. Also, when I do my 10-minute per day workout, I look and feel fresher with people commenting. I tell them it's a result of Cellercising, and hopefully they buy one for themselves. Thank you, Marie. Shalom writes, after Cellercising daily for the past 10 days at age 58, I can easily walk in high heels again. Can't believe it. I thought those days were long over. I've also gone down a clothing size in that time, and doing the lung opening move my asthma much better as well. This is a miracle exercise. I agree with you. I am a recipient, like many of you, to the miracles of what Cellercise has done. All right, I'm going to read one that came in this morning. I had a hard time reading it. I think you'll know why. This is why we're here. This is why we're here, to make a difference. There's nothing like this that I've ever experienced, and many of you know that. But just as a recap, the movement up and down for the lymph system, for the circulatory system, for brain activity, for proprioception, for weight bearing, it does so much, and there's so much we can do with it. It enhances body parts and functions. It doesn't tear down to build up. It's something we can do every day, several times a day. It's the only exercise I get, and I'm grateful for what it has done for me. All right. This comes from Laura. It's remarkable. She says, "Hi Dave, thanks for talking with me about how to recover using the Cellerciser. The Cellerciser helped me recover from long-haul COVID. Initially, I could only drape my body over the bar and do 12 baby bounces. I returned to work and secured a career improvement position with another company, a better position. 2 years later, I was hospitalized for over 2 months with around 50 days of intensive care unit critical care. For 3.5 weeks, I was on a medically induced coma and paralyzation. When they brought me out of the coma, I was still paralyzed and on a ventilator. Doctors and nurses described my extensive life-saving treatments as medical torture. They called me their miracle because I lived. Prayers work. I was transferred to an inpatient rehab hospital for 8 days of physical therapy, occupational therapy, speech therapy, and respiratory. My physical therapist and OT stated they could tell I was in good shape prior to the illness due to my quick progress that challenged them to challenge me. Thanks, Cellerciser. Outpatient failed to challenge. The outpatient PT, physical therapist, failed to challenge me. Per my conversation with Dave, I started with sitting on the Cellerciser and holding the bar. Yes?
Did you put your finger in the computer when the computer turned off?
Oh, sure.
I need you.
Sorry, the screen timed out on my son. Outpatient PT, physical therapy, failed to challenge me. Per my conversation with Dave, I started sitting on the Cellerciser and holding the bar. The second week, I added a baby bounce and hip rocks. On day 47 of recovery, I was able to do leaning kicks that looked and felt like small kicks. Less than 2.5 months from paralyzed on a ventilator and only able to answer yes/no questions by blinking my eyes to walking unassisted, no cane, on reasonably level surfaces. My doctors have been surprised by the improvement of my health as evidenced in x-rays and labs. Thanks, Cellerciser. I baby bounce while doing my hand and wrist exercises with flat bands and isoflex balls. Thanks for the hand gyro recommendation on your live session for nerve and muscle damage. The RPM Powerball and Power Spin have accelerated my hand and wrist movement improvement. I highly recommend the Cellerciser. It worked when I was too weak to stand on it. The Cellerciser helped me at my weakest when standing was very difficult. It has allowed me to strengthen my balance, muscle, and endurance due to its versatility. Dave, your willingness to talk with me at my weakest and your videos have been invaluable. Thanks, LJ. And thank you, Laura. This is why we're here. And if we can make the difference in the life of one person, it's great. If we can make the difference in the lives of many, how much greater? So, thank you. You want to have your Cellercisers ready. I mentioned that early on when we didn't have sound, because we're going to go through a knee routine that's going to take a little bit of time. So we're going to have 2 sections. We're going to have a beginning section, and then we're going to have, after that beginning section, we're going to go to more of an advanced section. So Debbie writes, I seem to be bothered by plantar fasciitis in both feet. I've been Cellercising for 1 year and 3 months, and this seems to be just be coming off in the last 6 months. We mentioned this last week about getting some soft-soled slippers or some additional support while you do the different movements on the Cellerciser to loosen up the fascia. It can take a little bit of time, but when the foot loses flexibility in circulation, and that's the weakest area of circulation in the body, is the lower extremities, the furthest area from the heart. So we need to help the body do its job more efficiently. When you're pumping with the Cellerciser, the tissue is gently expanding and contracting. You're not hitting a hard surface, but you are going to get movement in the foot. Now initially, if you have issues with plantar fasciitis and you start to get some movement into it, it can, yes,
We have
Justin.
a question from Lisa.
Hold on one moment, let me finish this one. Thank you, Justice. But that tissue is going to become more flexible again over time. And we've seen that happen over and over again. And then when it becomes more flexible, then you can go out and do more exciting routines and events without worrying about tearing that fascia. But again, if you have a medical concern, check with a medical doctor. Yes, Justice.
Lisa Turk says, Dave and Justice, many things for the live. I'm growing stronger daily from doing Cellercise. Can you please recommend a stretch for my tight it band? Mine gets so constricted it can be hard to straighten my leg. Many thanks.
You bet. She's talking about the band that wraps around this hip area. And we're actually going to do a little bit of that tonight, because the movement we do when we do the ski patrol, the whippy ski patrol, it also works that muscle to help loosen it. So you'll see that when we're actually doing the routine. Thank you, Justice. Awaken Indigo says, what is the age that I can start putting my newborn on the Cellerciser, if it's okay if I keep him in my arms and slowly bounce, even if he's just 1 month young? Justice, guess what I did with you when you were a baby? Yeah, brand new. Great way to burp a baby, by the way. And a great way to help the baby fall asleep, as well as help you to be relaxed. I would immediately, at a very early age, all the kids were placed over my shoulder, and I would gently move up and down. They love that movement. You don't remember, but you'd say, yeah, Dad, I love it. Keep going. No, I'm kidding. but you did like it. And it was a great way to help them relax, help them with the colic as well. So that gentle movement, wonderful for baby, wonderful for mom. Just make sure they're well supported. But we do it anyway. We do the same thing. Generally, we're just not doing it on a Cellerciser. So the baby's getting the benefit, but we're not. When we're on the Cellerciser, we're both getting the benefits. We're opening up circulation to help reduce stress. Mary writes, Steve Harvey has a new approach and supplement out that is supposed to work on a cellular level to improve mitochondria. We addressed that one too last week. Lisa says, how do I stretch? Okay, a very tight IT band. We're going to talk about that. I wonder if I got the right questions today, or if I got them mixed up with some other ones. Oh, okay. I think it was supposed to be these. Oh yeah, how did I do that? I ended up switching Christopher's ability to it was the last schema system, Melissa. Nope, those aren't questions, those are, see if that, okay, most of these look like the ones I answered last week, so maybe I copied down the wrong ones. I'm loving my Cellercise equipment. I started with baby bouncing several times a day and right away noticed stronger feet, legs, and glutes. I'm walking with more fluidity because my feet are more flexible, my balance is better, and it's fun. I think they're just mixed together. One of my loved ones had tennis elbow and tendinitis and fingers with scar tissue from an injury. Do you have any ideas for him? And yes, that was, again, the Dynaflex ball, which we talked about on the last program as well. Okay. Mark writes, we've had our Cellerciser a few weeks and are loving it. It has been oiled twice, but squeaks remain. We use about 20 minutes a day. At that rate, how long do you think before it's broken in? Thanks so much. And Mark, it takes a little bit of time for that steel to polish itself and improve. Okay, so let's get our Cellercisers out. And are there any questions, Justice? Okay. Because I'm going to take you through the routine for those who want to work on their knees. And in my particular situation, and many of you have heard the story, I was goofing around with my daughter, Justice's older sister, Brooklyn, and I had my feet, I was kneeling on the ground, my feet behind me, I sat all the way back to the ground, tried to lift her up, she got on top of me, and I tried to lift her up, and the leverage was too much for the knees, so they both popped, and they were very painful. I had a hard time with them. The right knee took months to get better. The left knee just didn't seem to be getting any better. And I went to a chiropractor, one of my customers, Dr. Christopher Chapman, because every time I bent the knee, you could see it literally pop out of joint. And he said, stop doing that. And he got me an MRI that very day, had the MRI done. They noticed that I'd torn it horizontally and vertically in more than one area. And they said I had to have surgery to put it back in place. But they noticed lesions in my meniscus from previous tears. And I asked them, what do you mean by lesions? And they said, well, it's where you've torn it before. And I said, it healed. And they said, well, yeah. And I said, why wouldn't this heal? And they said, at your age and the condition of this is, you really need to have surgery. Well, I didn't want surgery. So I got a knee brace, one of those things you can pick up on Amazon or at Walmart. And I put it on the knee, and I started to do some of the very movements that I'm going to share with you tonight. And in the process of that, it took about a year. And I would feel, anytime I felt a little soreness in the knee, I was grateful, because I knew that I was causing enough inflammation that it could continue to heal. So that's what I believed. And it proved to be true, because 1 year later I was on Fox News live doing a demonstration, and I stuck my right leg out, sat all the way down on my left knee, the bad knee, and stood all the way up again and realized it's fine. So we're going to do some of those exercises in just a moment. Yes, Justice.
We have a question from Kimberly Gregory. Sorry if I pronounced it wrong. She said,
Kimberly.
She said, still suffering from post-tibia tendencies since December PT. Did not make it any better. I am trying to do baby jump for 10 minutes. Any recommendations? Thank you.
Yeah. She was suffering with TB, meaning tuberculosis. I'm not sure what that was. Did it say, Justice? Did she say? Yeah, I'm not, if I can have a little more clarification on that question.
She said, still suffering from post-tibia tendinitis since December.
Hold on one second, let me take a look at this. Where is it?
Saying it wrong.
Where?
Still suffering.
Oh, tendinitis.
Oh, sorry.
Tendinitis. Okay, yes. That's, can you throw me that Powerball again, Justice? It's in there. There you go. Yeah, the movement up and down on the Cellerciser, where we can actually, we're moving fluid, we're causing tissue to expand and contract, it's weight bearing, and then we add movements. And as we're adding the movements, we start to, over time, strengthen, increase flexibility, promote the health of the tendons. Getting a little, this is a Powerball, it's called a Dynaflex. You can pick them up on Amazon. And using the Dynaflex while you're bouncing, you're moving fluid up and down through the whole body. The tissue is expanding and contracting, and you're working the ligaments and tendons. And it's offered a great deal of help for many people that have had tendinitis, both in their elbows as well as carpal tunnel syndrome with their hands too. Okay, so you're gonna have to watch me, because I was originally gonna put this on the big screen, but because that's technical and I didn't start early enough, I will let you follow me as we do this. So this is a routine that's literally 20 minutes. It's going to have the beginning parts for most people, And knee issues are a big issue. I get the questions all the time. We've got a few different routines that we have done specifically for the knees. This is just another one. But it's one that I go more for beginning, and then we go to advanced. And I'm going to excuse myself for one moment. While I grab this, because we're going to use that in a moment too. All right, so let's get on our Cellercisers. Let's have some fun. And again, you guys are some of the most patient, wonderful, supporting people that I know, because this has been challenging today, but you're still there. So I appreciate it. Justice.
Anne-Marie says, how does this help osteoporosis?
It's all weight bearing. So osteoblastic activity occurs when you apply increased weight on your bones or skeletal system, so that the body responds by fortifying the bones with more mineral. And that's exactly what Cellercise does. It's all weight bearing over and over 100 times a minute, but it's not jarring. See, the ballistic impact of hitting a hard surface, although that can help build bones, it can also help tear them down, especially the joints. Yes, Jess.
And then Kimberly says, how do you use the ball for the foot with tendinitis?
How do you use the ball? Oh, you don't use it. Okay, you don't need it on the Cellerciser. When you're on the Cellerciser and you're just gently lifting your heels up and down, they can see okay on the screen. Yeah, you're working all those tendons and ligaments. When you're rocking side to side, it's very gentle. You're not getting a lot of movement, but it starts to help with the tendons in the foot as well. And then beyond that, when you're done and you've worked it and you've increased circulation, you can massage it with your fingers as well. And that adds a little more benefit, is getting deeper in those areas, and then you can get on the Cellerciser again. So you can go back and forth to increase the flexibility in all areas of your body, pretty much. Yes, Justice?
Jill Meekley says, how can I increase bone density in my arms on the Cellerciser? My hips are fine, but my arms have mild osteopenia.
Yeah, what people don't understand often is that the Cellerciser, as far as increase of weight, isn't different from the bottom to the top of your head. It would be if we were hitting a hard surface, because the ballistic impact is going to be absorbed through the area that receives the jarring. But Cellercise has an acceleration deceleration effect, and it's almost the same from the top of your head all the way down to the bottom of your feet. So you have this pumping action, if you can visualize this, that's working through the entire body. And if you ever want to experience that and really see how powerful and dynamic that is, just stand on the Cellerciser, put your fingers on your trapezius muscles, just grab the muscles here, squeeze them, or grab the deltoids, doesn't matter, squeeze those, and then bounce up and down. It's not just on the bottom of your feet. You're exposing the entire body from, again, the top of your head down to the bottom of your feet, with all this increase of G forces through what we call acceleration, deceleration, and gravity. Yes, Justice?
Anne-Marie says, can you wear sneakers?
I wouldn't. You can. I mean, it's not going to hurt the unit. But if the sneakers have they have different definitions of sneakers today. If the sneakers are really thin and they have a lot of flexibility for the foot, then yeah, that offers a little additional support while you're doing it. Probably okay. But I'm not an advocate of wearing shoes when you're on the Cellerciser for this reason. When you're doing different movements, your foot wants to support your natural alignment. And when you're wearing a shoe, it is restricted to the flexibility of the shoe. And that can actually cause more foot issues when you're on rebounders or mini trampolines. On a Cellerciser, as I move, my foot has all the flexibility to move with me, to support me. And over time, that means the foot, the muscles, the bones, they get more movement. As you get more movement, you get more fluid, more circulation, and you're less likely to have foot injuries by doing something strenuous, because the body can move, or the foot can move to support your alignment. But with a shoe, you become more dependent upon the restrictive the restrictiveness, the restrictions of the shoe itself. I hope that makes some sense. Anything else, Justice? We're good? All right, we're going to get started. Let's get our Cellercisers out. And I'm going to go ahead and turn on some music this time. One of the things, just so you know, that I really like about the app is I can put it on and watch a television show, and that's generally what I do. But when we're going to do it here, I'm going to go ahead and turn on the music. Okay, so we're going to do 1 minute of just a baby bounce. We're going to warm up the tissue. And you can, thank you, Justice. Just warming up. And you've got different music that you can play on it. And hopefully you can hear me well enough now with the recording. Okay, so we've got almost 30 seconds. Yes, Justice?
Catherine says, double meniscus repair a few years ago. What is the best movement and for how long to strengthen?
To strengthen what?
meniscus.
M what? Sorry.
meniscus.
Oh, meniscus. Yeah, we're going to do that. We're going to be working on the meniscus on these movements. Okay, so we're rocking left to right, and we're lifting our shoulders up and down, pushing down a little bit into the mat. So we're working the hips, the thighs, the knees, the back, but kind of loosening everything up. 2 seconds. Okay, breathe deep. You don't need to do too much of that when you begin, but all right, now we're doing the jamba walk for a minute. We're pushing down into the mat. Want to keep your back straight, kind of on the back of your heels, and we're working the whole front area of the knee. So those supporting muscles and ligaments, they're getting a bit of a workout right now. All right, I'll keep you posted. We've got about a little over 30 seconds left to go. And you can sit down a little further if it's too easy, so that you can actually be pushing a little harder. 15 seconds. See, the jamba run's more intense, but not by much. Jamba walk can be very good and very intense as well. All right, baby bounce for 30 seconds. And if your knees are bothering you, you don't have to sit down as far. So, and as you're building up the knees, if they're bothering you, getting a knee brace is a good idea. Or sock, one of those supports. 2 seconds. All right. Another minute. We're working the thighs and the knees. All these muscles here, you can actually feel them working, and that's supporting the structure of the knee. The objective here is to build up the supporting muscles and ligaments around the knee so we have less pressure on the joint, better support, where we can actually get more fluid, more circulation and support in the knee. Now, we've had some customers who have actually had knee injections and they only needed them once because they began doing the jamba walk 15 seconds and it became strong enough that it really supported the knees. They didn't have the problem. Okay, we're done. All right, so now we're going to do the hip rock. One thing I forgot to do is turn on my little wireless 2 seconds module, which would let me know what else was going to be going on. Okay, so we're doing the hip rock again. It's supposed to be which I missed something there. The advantage of having the little wireless module with the Mr. Rebounder app is it lets you know how much time before the next movement, but it also lets you know how long the routine is and what's coming up next. So I don't have that showing right now. Okay, another 20 seconds. Ten seconds. All right, another jumbo walk. So again, we're focusing on the supporting muscles and ligaments in the knee. At the same time, we're really building up and improving circulation in the thighs, because those are the big muscles. And as we improve that circulation, we also increase metabolism and we burn fuel. So it does burn calories. 30 seconds to go. And again, if it's not challenging you enough, just sit down a little bit further. Trying to stay as flat-footed as much as you can. 5 seconds. Okay, now we're going to do the hip rock again. And this is helping to pump circulation through the body. And that's what we want. Two seconds. All right. Jumbo walk for 30 seconds. So if you want to push yourself a little bit, you can sit down a little bit further. There's only 15 seconds left to go. Okay, so now we're going to do the health bounce. And that's the beginning section. After this, we're going to do something a little different that's not really on the Mr. Rebounder app, but it helps people who are wanting to increase flexibility in the knee or who are also recovering from a knee injury. What we're going to do is we want to have the Cellerciser next to something that we can lean over, whether it's a table or a chair or the arm of a couch, because as we lean over, we're going to kick up and we're going to do squats. The objective is to increase flexibility now in the knee as well. So it's both strength and it's flexibility, and it's a tough one. So it goes like this. And you can stop if you need to at any time. And that's good for me. All right. The next movement, all right, give yourself a moment. We're gonna let the knees recover a little bit. The next movement would have been jumping jacks, but where you're kicking your legs out behind you. That's too much weight right now on the knee, as you can tell. So I'm going to alter this routine a little bit. But those neat D bends where you're bouncing up and coming down, that is what restored the flexibility in my knee. So I could be at a Walmart, kneel down to the lowest level, bend down, and be able to get various different things. Okay, so now we're working hips, inner, outer, thighs, and lateral knee. Be careful. If you need to, just do the hip rock. But again, this is now for more advanced movements. Okay, we've got 50 seconds left to go. So the knees are both recovering with the Cellerciser. They're also getting stronger and increasing circulation. "30 seconds. Go at your pace. I only do 20 of those deep knee movements, so I'm going to adjust the timing on that because we did almost double that, and I felt it. Okay, now little movements where be careful. I don't want anybody to get hurt. So if you have to hold on to the bar and just do this, that's okay too. This one here is excellent for that T-band that was mentioned earlier. Okay, 20 seconds to go. Great for balance, dexterity. You'll get better at this. Okay, jogging, just moderate. Yeah, I said this is a little more advanced. The second part of this routine. Something to work toward, though. Three, two, 1 second. All right. Ski patrol, both feet together, jumping side to side. You're going to give your knees a workout. And if you need to go faster, go ahead. "25 seconds. "10 seconds. Justice, you should try this one. 5, 4, 3, 2, 1. Hip rock. All right, 30 seconds. And again, if all you can do is the first part of that section, that's great. If you want to do just the first part of it twice, that's even better. But going beyond it, it is more advanced. Five seconds. Okay, health bounce. Oh, I was supposed to be another one of these. Yes, Justice.
Pamela says, is there a way to tone down the knee bend?
Yeah, tone them down. Yeah, just don't bend as far. So when you go, just go like this. Just absolutely, just like that. That's still going to give you benefit until the knees become stronger and more flexible. Good question. I meant to mention that. And I'm going to stop. If you keep going, that's great. We got 3 seconds left. Okay, ski patrol. This is going to go in our advanced routines for certain. We have easier programs for the knees. I think we've done like 4 programs so far. So this is the 5th and the longest. Two seconds. All right. For those who are wanting something more intense, ski patrol 2. This is the last one before the baby bounce. It's the same burn feeling you would have if you were on the slopes. The slopes. 20 seconds. Ten seconds. 5, 2, 1. All right, we're done. Now let's just gently move up and down and get that circulation going. Love your comments, what you like, what you didn't like, things that we can do to make it better
and we'll do that. All right, 30 seconds. That was using some of the biggest muscles of the body. So we're going to sweat a little bit more. We're going to generate more heat, faster metabolism, and burn off more fuel. But the focus is really on the benefits that those movements have for the supporting muscles and ligaments around the knees. 5 seconds. I want to thank all of you for being here, for your patience, for your support, for the efforts that you've made. I know Cellercise is a little different for everybody, but everybody, I really believe, can achieve a benefit from the movement up and down on the Cellerciser. So if you have questions, feel free to write them in, comments, suggestions. We are always looking for them. Thank you very much. Stay focused. Work at being happy. Help others become happier. You'll be happy too. We look forward to seeing you in a couple weeks. Thank you. Share it for those who say that, Cellercise, there's nothing to that. That's not going to do anything. Go ahead and give them this routine. Thank you. See you in a couple weeks.